Hi guys, this is
Genesis.
Radio with Lorena, Cristal, and Julieta. And today we're going to talk about attention deficit disorder, ADD and ADHD. So now let's talk with Lorena, who is going to tell us what is ADD.
Hi, Crystal. First of all, I want to make clear that ADD is not an illness. It is a deficit, which means lack of. In this case, it means a lack of self control. So, ADD is a condition in which someone has problems with learning and behaving because of being unable to pay attention to something for a certain period of time.
Thanks, Lorena. Now that we have cleared the meaning of ADD, let's talk with Julieta, who is going to tell us which are the symptoms and the diagnostic of ADD.
Hi guys! Well, first, if you know a person who has ADD, the first step is to talk with a healthcare professional to find out if the symptoms fit the diagnosis. Healthcare professionals use the guidelines in the American Psychiatric Association Diagnostic and Statistical Manual to help diagnose ADD. This diagnostic standard helps to make sure that people are appropriately diagnosed and treated for ADD. Some of the criteria used for evaluating and diagnosed ADD are inattention, hyperactivity, impulsivity, and aggressivity. But besides all that, the most important thing the American Academy of Pediatrics recommends is that healthcare professionals ask parents, teachers, and other adults in case for a child. And in case of adults, some of the symptoms are trouble at getting organized, are extremely distractible, and poor listening skills.
Nice. Now, Crystal, can you tell us the grades and types of the ADD?
Of course, there are 7 types of ADD. First one, the classic ADD. This is the easiest one to recognize of the 7 types of ADD. Primary symptoms are inattentiveness, hyperactivity, disorganization, and impulsivity. Of course, there are 7 types of ADD. First one, the classic ADD. The symptoms are inattentive, distractible, hyperactive, disorganized, and impulsive.
Increased brain activity during concentrated tasks. Second type of ADD is inattentive ADD. The symptoms are short attention span, distractible, disorganized. Third type of ADD is overfocus ADD. The symptoms are core symptoms of classic ADD plus trouble shifting attention, going from thought to thought or task to task, getting stuck in negative thought patterns or behaviors. The fourth type of ADD is the temporal lobe ADD. The symptoms are core symptoms of classic ADD as well as learning, memory and behavioral problems such as quick anger, aggression, and mild paranoia. The fifth type of ADD is the limbic ADD. The symptoms are core symptoms of classic ADD as well as chronic low-level sadness, not depression, moodiness, low energy, frequent feelings of helplessness or excessive guilt, and chronic low self-esteem. The sixth type of ADD is the ring on fire, ADD plus. Symptoms are sensitivity to noise, light, touch, periods of mean, nasty behavior, unpredictable behavior, speaking fast, anxiety, and fearfulness. The last type of ADD is the anxious ADD. The symptoms are core symptoms of classic ADD as well as being anxious and tense, having physical stress, symptoms like head, chest, and stomach aches, predicting the worst, freezing in anxious, providing situation, especially if being judged.
That's right, Crystal. If you don't mind, I'd like to talk about treatment, or cure if we can say. But I think that before you guys know about the treatment and its functions, you should understand why does someone born with ADD. In this case, I had the opportunity to interview the psychologist Alonso Pina, who explained the cause of ADD. And well, I would like to share it with you. So here it is.
Son neurotransmisores, se llaman neurotransmisores. Es decir, que está una neurona aquí, está otra, imagínate que está otra acá, es como si fuera una conexión, ¿verdad? Entonces, esta manda la información, ¿verdad? Por ejemplo, de lo que él capta a través de la vista y el oído. Entonces, el oído y el ojo, imagínate que tienen como un cable, ¿verdad? Entonces, ese cable lleva la información hacia el cerebro, ¿verdad? Entonces, pero muchas veces se pierde esa información en el camino o no llega. ¿Por qué? Porque el cable no es a lo mejor continuo, sino que se junta con otros, y en esas conexiones con otros se pierde, porque entre ellos están los neurotransmisores, ¿verdad? Es lo que secreta la sustancia. Entonces imagínate que aquí no corre la sustancia esa, y entonces a lo mejor ya la información llegó como a la mitad, ¿verdad? Entonces a lo mejor por eso él ya de repente se pierde pensando en otra cosa, que en los videojuegos, o su mente está en blanco, ¿verdad? Porque está, no sé, en otra cosa. Entonces, esos neurotransmisores, ¿cuáles son? Pues hay varios que tienen que ver con esto. Estamos hablando de serotonina, dopamina, noradrenalina, ¿verdad? Que son los que entrarían dentro de la función, ¿verdad?
Basically, what he said was that neurotransmitters function like cables, from which information travels through, information captured by sight and hear. That information is transported to the brain, but sometimes the neurotransmitters that carry that information are connected to other ones, in which information can be lost. So when it arrives to the brain, not all of it does. So that's what generates the loss of attention in people with ADD.
That's right, Lorena. Most of the times when a person has ADD, this information gets lost on its way, and it is when they get distracted. And it is also involved the reaction of serotonin, dopamine, adrenaline, on the neurotransmitter.
Okay, I'm going to tell you medicine. It's clonazepam. It is used in ADD treatment. What it does is that it decreases a normal electric activity of the brain. And it's just one example of medicine that doctors give to ADD people.
Okay, guys, maybe you'll be asking yourselves, why are we talking about this? And well, we want to create consciousness about this topic for you to know more about this deficit and maybe detect it on the people you have near to you. Did you know that in the 50s, 1 of 10,000 children presented this deficit, and nowadays, the 12% of the total population has it, so it's increasing, an alarming situation.
Thanks. We hope that with this podcast, our audience have learned more about ADD. Now, you know about this important deficit, cause awareness about it, and take cautions or detect if a person who is near to you has ADD.
Bye.